need to define what the goals and objectives of our various thoughts in relation to helping refugees using telemedicine. And one is that we want to have impact, and ultimately that's translated to less mortality and morbidity, and also improve well-being. But that's hard to measure, that our intermediate step is to increase access to care, increase the quality of the care that's accessed, and also increase access to information. And in itself, in addition to better care and more care, that's a good in itself. And that the main outputs, the things that we will hope to produce through the ideas that we mentioned, through work with the CIR, is increased information flow leading to increased availability of information at different levels. The other thing we talked about that's very important, it was very helpful to brainstorm and to have some idea about what to do, but this can't be the final spot. It's very, very important for us to do our research, consumer research, or I guess the word patient isn't so much in vogue now, but that we have to do our homework. And that involves talking to all the various stakeholders, and that's refugees, as well as the ministries of health. And there, with apologies to the Iraqi delegation, we think that the Iraqi Ministry of Health is one very important stakeholder, but when we're talking about refugees, a lot of that is going to happen in other places, like Jordan and Syria, and so there's going to have to be international collaboration. And the Ministry of Health in Iraq, we thought, even though this would not be in their borders, that they would be very interested and would want to be one key partner, but that this would have to be a collaborative work. And then finally, also agencies, and someone in the group who represented donors and was familiar with that point of view said, you're not going to do anything if the donors aren't on board.